Dear colleagues, honored guests, and dignitaries, it's lovely to be with you. I wish I could be live in Baku, but instead of that, I will jump immediately into my presentation. Give me a second. So, as we all know by now, we've been dealing with extraordinary temperatures, and we have managed to heat up our planet much faster and much hotter than we expected that we would be doing. 2023 has been breaking all kinds of records, with average global temperatures up to 1.46 degrees Celsius. And the problem is that 2024 the trend didn't really stop. We have been really going above and beyond all previous types of average temperatures during January, February, March, April, and May. So we are, scientists are starting to say that we are in really uncharted territories in relation to how fast and what kind of impact that's going to have on our societies and our health and our well-being and the well-being of our planet. So the heat is kind of the mother lode. So I keep talking about heat because heat is the main, the silent killer that is linked to the highest numbers of mortality and morbidity around the world. So, for example, in Europe, where we do have data, we know that in the summer of 2022, we lost more than 61,000 people from extreme heat. But heat is like the global average temperature, which is global warming. Duh, we haven't been talking really about heat. But heat also means that locally we have extreme weather events that really exacerbate a whole series of other extraordinary weather phenomena, like long periods of drought, wildfires, also extreme rainfall and flash floods, and all of the concomitant different events that impacts that this has. And the problem is that, you know, it's like we can't see these things as anymore as in one sector. We more and more understand that each kind of extreme weather event or shock is linked with a whole series of stresses. And when it happens, we have a series of direct and indirect impacts. So the main kind of systems that we see being affected are not only our health system, which is kind of the basic and the most important one, but also our ecosystem and water and water systems, infrastructure, our economy and finance, and food. Finally, food security is affected. And the problem is that all of these systems create feedback loops which exacerbate the effects that we see. So any kind of solutions have to really be considered in a much more systemic way. And for example, if we take the healthcare system, in order to create a more robust service delivery and to create more resilient health facilities, and to make sure that our system works together by being more network and more responsive to the types of services that we need during an extreme weather event. We also know that we need emergency response agencies to be right there and to be ready to kind of take on the immediate type of civil protection actions that they need to do, and to be correlating with our health systems. But also we have to have really good quality and robust infrastructure system, so that when the extreme weather event happens, we also have electricity, we have transportation, water, etc., so that we can help the people that are most in need. And this is the real fear, that we might have an extreme weather event, collapse of one of our main infrastructure systems. we know that the health, particularly the health system, has to deal with a whole series of direct impacts, and we have to kind of build capacity among our health workers to recognize and to best respond, again, to heat-related symptoms and illnesses. And at the same time that we have to think of indirect impacts, like, we have many, many more work-related accidents that we have to deal with. We have to deal with new vector-borne diseases, and a whole series of other things that we have to consider and to prepare for. And we have to kind of realize, and what is helpful, we have to kind of create a series of indicators that basically create the right kind of standardized responses that we need to build in our systems. And that means recognizing who is exposed and who is most vulnerable. And apart from the general categories of, the people, heat has this amazing capacity of going and finding in our cities who are our most vulnerable, and targeting our poor, our young, our old, our people with pre-existing conditions, the people with the worst kind of jobs, et cetera, the women, the pregnant women. But there's a whole series of other qualifiers that also make these general categories more or less vulnerable, like, what kind of sleep deprivation they had, what kind of mitigation, heat mitigation methods do they have access to, et cetera, et cetera. So we do know, however, clearly that heat is really creating an incredible amount of mortality among our most vulnerable groups. Here we see for globally, the population above 65, how fast they have kind of, the mortality rates have grown. But also we know and we have measured now, we're starting to see our solutions, what kind of impact they can have. Like, for example, if we manage to increase our canopy coverage by 30% in our neighborhoods and in our cities, then we know that we can decrease and prevent 1/3 of premature deaths that are linked to extreme heat, to extreme temperatures. And we see cities starting to adopt methodologies like the three trees from your window, 30% canopy coverage in our neighborhoods, and 300 meters walk from a good quality green space in our cities as an aspiration and as a way to kind of create better cities. We know also that we need to really raise the amount of financing that we give to climate in general, mitigation, but also adaptation. We see adaptation being totally under financed, and mostly from public funds. We need to kind of change this, and we really, really need to step up our financing for climate in general, from 1.3 trillion to 8 to almost 9 trillion, at least a year, in order to kind of keep the temperatures below 2 degrees. For heat, one of the things that I, as the chief heat officer, suggest for cities is this triptych of making sure you raise awareness, you have in preparedness measure, which focus to the most vulnerable during the extreme weather event, and then how do we redesign our cities to make sure that we respond to the climate era that we're in, instead of doing infrastructure that responds to 50 years ago, and actually infrastructure that can create public spaces that are cooling our cities instead of heating up our cities. And we have great solutions around the world, like Amsterdam, which created green and blue rooftops on social housing complexes, and measured how much they lower temperatures, how much they mitigate extreme flooding and in the city, but also how much they reduce the energy consumption. In Seoul, South Korea, they dismantled the 10-lane highway to daylight this river, which created a whole series of ecosystemic services, as well as lowering temperatures up to 6 degrees Celsius, but also helping with all types of other extreme weather events, again, climate events. Other cities that are nature positive, just examples are Medellin, that created 36 corridors, lowering temperatures on average around the city by 2 degrees from before, and at special parts at 4 degrees. Melbourne created an amazing strategy for urban forests and creating nature in the city, so that the city, they articulated very clearly, can be a healthier city for the next generations. Sierra Leone worked together with the women who are the most vulnerable, especially because of the type of informal work, both paid and unpaid. They're much more vulnerable to extreme temperatures. And together, with Arsht-rock, they co-designed these shading elements for women that actually sell their products in Freetown. Paris has created many things to lower temperatures, but one of the most interesting ones is the schoolyard oasis, again co-designing with children and with teachers courtyards that are much more shaded and much more cool for children to play in. And finally, Freetown did a really brilliant method of planting 1 million trees in order to make sure that together with the community, to make sure that they stop landslides, they lower temperatures, and they deal with flash floods. And finally, Ahmedabad in India, working together with SEWA, the Self-Employed Women's Association. We created a special parametric insurance innovative tool, which not only informs women about the dangers of heat and gives them a whole series of wraparound services, but also releases their daily wages when temperatures go above a specific threshold, so they don't have to choose between feeding their families or risking their lives. I will stop here. I wish you a great continuation of this panel, and all the best for your proceedings. Take care.